Hello, in this video we will discuss about the short note of hiatal hernia, the pathophysiology. So the what is hiatal hernia we will look at in this video, and we will learn first is the digestive system. And what is the digestive system? Here is the digestive system contain a stomach. This is the esophagus will lead to open into the stomach, and this is the diaphragm here, and this is the stomach, and the large intestine and small intestine. Large intestine composed with the ascending, transverse and descending colon, while appendix and small intestine contain duodenum, ileum and ischium and jejunum, sorry. And in this way here is the anus and rectum, and this is the small intestine. So let's begin to understand what happened due to the hiatal hernia and what is the major disease causing agent due to the hiatal hernia. So in this way, this is a normal person which that's contain a stomach, and it is the normal diaphragm, and you can see in this esophagus and diaphragm and stomach, this is normal esophagus stomach, and basically it is normal, and you can understand here. But we will learn about the here is the esophagus sphincter. It is also known as the cardiac sphincter will be closed during the digestion in the stomach, the protein digestion, for example. So remember, a stomach fluid is contain a much more acidic medium, the pH 2.0. So in this way here is the sliding hiatus hernia. In this way the basically is the changes and lead to acid reflux. And acid reflux means the opening of the esophagus sphincter will be occur and not closed completely, and in this way the acid will be move upward into the esophagus, and it will lead to chest discomfort, heartburn, not abdominal pain, but it will be after the some time, but the burning sometime and nausea and vomiting sometime. But in the case of the progression of this disease will lead to paraesophageal hiatus hernia. In this way, the bulging of the stomach in the outside, and in this way the paraesophageal hiatus hernia will lead to chest pain and severe and chronic heartburn and frequent burning, burping, and the throat soreness and bulging and nausea, vomiting and chronically vomiting, and it will cause severe pain suddenly. So the subsequently it can cause the pain as well as increase the sympathetic nervous system will lead to vomiting, the emetic reflex. So the sympathetic nervous system increase due to the indigestion of the food and the move upward. So here is you can see this the food, the acid during the digestion will move upward, will lead to damage the wall of the esophagus. So the esophageal sphincter, hiatal hernia is here, and the diaphragm is this, and let's begin to understand the middle stage of the hiatal hernia and what is the causes in the esophageal wall. So this is the cell injury will due to the chemically, and chemically cell injury means the cell will be damaged due to the some reason the acid will be intact with the cell will change the cell structure. So the cell injury chemically will change lead to cause cell death, apoptosis or necrosis, while the cancerous causing agent the acid will change the DNA will lead to cause or the adaptation. Adaptation means the cell can be changed their structure, their shape for the survival, and the cell can survive. Otherwise, here is the DNA, which that will after the damage can cause the epigenetic mutation, will lead to change the cell structure for adaptation, while the damaged DNA and the damaged DNA will lead to cause the tumor formation, the benign tumor or malignant tumor. And the oncogenesis will occur. Oncogenesis means the malignancy and cancer causing process due to the activation of the DNA the activation due to the which that was the inhibit the oncogene can be activated due to the methylation to acetylation or something, or DNA break, but it is rare. Remember, but the cause of hiatus hernia can be a being born with unusually large hiatus will lead to cause the hiatal hernia, while the injury or trauma to the area such as the force from a seat belt during an accident, which that also the part of causing the hiatal hernia. But on the other hand, the obesity is the major cause, because the obesity will push the stomach, and the acid reflux will lead to cause hiatal hernia, the bulging of the stomach outside from the diaphragm. So between the diaphragm should be esophagus separate. So the persistent and intense pressure on the surrounding muscle caused by chronic coughing, lifting heavy object, repetitive vomiting, and the straining during the bowel movement. Okay, now we will discuss about the medication for inhibition of acid or block the acid production. But before the medication, we will understand about the diagnosis. So the diagnosis is too much simple. The upper endoscopy can be used, and in this way, first of all, here is the medication for the inhibition of acid or block acid production and heal. But first of all, we should understand about the endoscopy and the diagnosis part. So the diagnosis is through a endoscopy, but remember the taking of the tissue from the esophagus can check the cell structure, and that is the different pathway for checking the cell structure, either cell is good or not. On the other hand, the screening through a visualization, through a visual screen, we can detect after the passing the endoscopy into the wire and through a camera to show the structure of the stomach, and we can understand. But if the diagnosis is the positive, then the medication recommend. If the negative, so we can say that the complication is different. But here is the H2 receptor, the medication H2 receptor blockers can be used with the cimetidine, the tagamet HB, and the formatidine, the pepsid AC, and the nizatidine, which that is used for this. But remember that the H2 receptor, the blockers, which that block to decrease the acidity in the stomach. So thanks for watching. Bye.